As Kay here states, music therapy can help you express yourself, but it can do so much more. So in this video, we're going to talk about what music therapy is, what you can do in a music therapy session, and how it works. Hi, my name is JD, and I'm a statistician and music therapist here to offer statistically significant support. And if you don't mind hitting those like and subscribe buttons so that you can get the support as it comes up. Now, the American Music Therapy Association has their own definition, their own official definition of what music therapy is, and I encourage you to look at that. But my personal definition of music therapy is the intentional use of music to achieve improvements in quality of life. And this could be an area of your life that needs improving. So to better understand this, I have an example from Henry from the literature, and Henry had severe dementia. Prior to listening to music, Henry would be slumped in his chair and he wouldn't acknowledge anybody. And he would barely respond. But when his caregiver would give him his music to listen to, Henry would sit up and would move to the music, and he'd be lively, and he would respond when questioned, and he would even respond after the music had stopped playing. This example shows the natural benefits that music can give to people, but it's not officially music therapy. It's a thing that music therapists can do, but music therapy and music therapists do so much more than just let people listen to music. So music therapy provided by a board-certified music therapist is able to capitalize on these natural benefits, but expand them and make them purposeful to achieve that desired outcome intentionally and more frequently, and track that progress to make sure that it's working. Music therapy has been its own established profession since the 1950s. It even has its own standards for education and clinical training, standards for clinical practice, like a scope of practice, and a code of ethics. For what music therapy can treat, I want to quote the research here because it's so eloquently stated, and I quote, "It is used in a wide range of health contexts, including, but not limited to, autism, cardiac cases of anxiety, children and adolescents with psychopathology, stressed cancer patients, those suffering post-operative pain, migraine sufferers, and the terminally ill." Now, stress is placed on the professional application of music for therapeutic ends, and so its function is explicitly not for education or entertainment. And that last part is key. This is therapy, not education or entertainment. You're not going to listen to a concert. You're not going to learn the guitar. You're going to play the guitar to increase your finger dexterity, just as an example. But it's not just limited to that list. It can also treat conditions like dementia, pain and distress from pain, and schizophrenia. Music interventions can even alter your opioid and non-opioid intake, your heart rate, blood pressure, and respiration rate. From a practical perspective, I personally found that almost any condition can be treated with music therapy. What matters most is how well the patient connects to the music. To me, if the patient can connect with the music, then the patient will achieve better outcomes. Now, it's important to understand that music therapy is a multidisciplinary field. It's because we treat so many things that we have so many different ways of treating something. You can go to one music therapist and see a completely different style of music therapy with another music therapist. So on one hand, we can use different psychological theoretical frameworks to treat. So you can have psychodynamic music therapy, humanistic or behavioral music therapy, or cognitive behavioral music therapy. We also have different types of music therapy, like the body method of guided imagery, Dahl-Crow's Eurythmetics, Kodaly, neurologic music therapy, this is called NMT, Nordhoff-Robbins, and Orff Schulwerk. Now, all of these different types of music therapy require their own discussion and additional training, but I have a link down below and you can read that descriptions for those. I might make a video on each one of these later. But on the other hand, instead of just drawing from the arts, we draw from mathematics, natural sciences, behavioral and social sciences. When music therapists treat, we're musicians who apply artistic principles of musicology and music psychology, behavioral social science principles from sociology, psychology, and therapy, an understanding of medicine, biology, and physics, and a basic understanding of statistics to track and visualize progress. Music therapists then combine all of this knowledge with their understanding about the broad range of the clinical populations that they treat, and they do that to design music-based interventions to intentionally address that area of need for that particular patient. And one time a music professor once told me that he's never met a music therapist who wasn't scattered. And that stuck with me because it rang true. We're so many different people as we treat throughout the day that it's hard for us to stay on topic, if you will. And we are scattered. Because with all of the roles we undertake, to make sure that our clients get the best possible care, it's easy for us to become scattered and switch through those multiple roles. And all of this knowledge requires that we need to have a degree in music therapy to practice, a 6-month internship, and a passing score on a board certification test before we can practice. So with all of this knowledge combined, music therapists will then implement the interventions through a therapy plan and monitor progress through an evaluation method. But first and foremost, it starts with you as the patient and what you need. So if you were to come to a music therapy session, the music therapist would build a therapeutic relationship with you that's based on trust. Then the music therapist would work with you to develop music-based interventions that you would enjoy and that would also address your needs. And finally, the music therapist would help you resolve the tensions that brought about these needs to begin with. You can even bring your own music to the music therapy session because using your preferred music will bring about better improvements in your needed areas of improvement. And we can use your music as a starting point, because we can address the bigger issues or even work through your concerns through your song's symbology. And you'll be able to have say in the design of your intervention, so you can change the music, you can even use humor in the sessions, and you can do all of that while sharing your thoughts and experiences. And sharing the music that you like can even help build that therapeutic relationship with the music therapist, who can also share his or her preferred music with you. So you can see what each other likes, you can talk about what you want to do in the session. So, and I have a quote from B from the research saying, "What's nice with the music therapist is that he can teach me things that he likes too." And I like a lot of the same music that he does. And what you'll see is the music therapist has a broad range of likes. Now, I personally don't like country as a genre, but there are a few songs that I like that are country related, and I can use that to help build the relationship with the client. But even if it's a song that I hate, I would play that for the client because that's what the client wants. In my sessions, we would start with developing a baseline of behavior, and we would do that through an assessment. And that might take a few sessions just as we get to know each other. And we would take that and figure out an area of need that you specifically needed to work on. And once we did that, we would talk about how to best address that. So let's talk about self-expression as an example. This is something that we decided, you and I together decided that you needed to work on. And some ways we would address that would be singing a song and then talking about it and how it affected you. Or expressing anger through drumming. Or expressing a wide variety of emotions while playing the piano. And but the key thing is you are engaging with music to help in a healthy way express yourself. And I would be tracking your progress. One thing I might do is track, were you able to do that or were you not? Or how much will you be able to do that on a scale? And sessions would continue until our agreed upon goal was met, and that would be stated in our treatment plan. But you could also take these therapeutic experiences into your everyday life, like playing the piano or getting a drum set, so that you can practice at home. And clients often do that while they're in the session. They will get a piano so they can practice every day and then come and show off their progress in the session. There are many reasons why music therapy actually works, but one model for how music therapy works states that, one, it just grabs our attention in ways that other modalities can't. That music helps us modulate our emotions, that music changes how you think about things, and it does so within your cultural symbolism and meanings. That music can change how you do things, that music can be a form of nonverbal communication to help you change how you communicate. It's also important to remember that there are also brain-related changes when doing music therapy. So not only does the music therapy repair and regenerate the parts of the brain that it's affecting, but it's also protecting the brain. It's protecting through repetition and associations, which can delay degeneration or slow the progress of the disease. And it can reactivate a dormant neural system. And music therapy is effective and cost-saving. In just 3 to 10 sessions for a small effect, or 16 to 51 sessions for large effects for people with mental illness, they can improve their global state, general and negative symptoms, depression, anxiety, and function. And this is all when added to standard care. It's saved almost $3,000 in hospice care compared to standard care, and it's saved $10,000 per infant in NICU, while also increasing non-nutritive sucking and decreasing length of stay in the hospital. It can even help with echocardiograms in children by eliminating patient sedation and decreasing the number of staff members needed for procedures while saving $74 per child. So that, in a nutshell, is a high-level concept of what music therapy is, what happens in a session, and how it works. So if you found this video helpful, please hit that like button. And if you want more content like this, hit the subscribe button so that you can get more statistically significant support. Thank you.